Good afternoon. It's Thursday at 1 o'clock. Let's get started. My name's Corinne Waldo. I'm the Senior Director of Economic Vitality at the Boulder Chamber. And as we've done, I think we're closing out the second year. As we've done most Thursdays, except for a short break this year, we're doing a cross-industry update on COVID-19 and the pandemic as it relates to you here in Boulder County and the region. We will start out with some information from Lane Drager of Boulder County Public Health around data, maybe some recent information you've heard and what that really means, the vaccine verification program. Submit your questions in the Q&A feature. I'll ask them on your behalf. I did receive some questions this week via email, and I will ask those if we have the answers for them. And then I'll ask some common questions that I do receive. I've prepped Lane for a couple of those. Let's get started with Lane Drager, and then, like I said, let's move on to Q&A after that. Go ahead, Lane.
Thank you, Corinne. Thank you all for joining. Give you some of our key messages to start off with, and then we'll jump into the data. Overall, the case data indicates that our cases have stabilized, a little bit lower rate, and so we kind of have survived that Thanksgiving surge. It was not a significant one, so that is good news. We're continuing to monitor the Omicron variant that has been detected in the wastewater monitoring that's been happening in the county. So we know that there are additional people that are infected that maybe haven't yet to be identified. So we will continue to monitor that very closely. We've looked a lot. I'll share some more information later in the slides of what we're learning, on a global scale. So those who have been hit already and kind of what it's doing there. Our health system, we've been talking about this for weeks, is still under that significant strain, though. Even though our numbers have sort of stabilized, the healthcare system, those patients are not quickly leaving the hospital, as in addition to all the other strains that they're under. So it is really important that folks take as many precautions to avoid putting further strain on the system. We are seeing rapid uptake of booster vaccines, especially for higher age demographics, and I have a slide later on to show you some of that. So we definitely need things to be pointing to get that hope, and that this someday will end and we will eventually make it through this, but we still need to be diligent for the near term. So here's what's going on with cases. I mentioned we kind of survived that Thanksgiving surge. It was not as significant, which was good. And then now things are dropping again, which we hope is a trend that continues. You can see we are still way above that red line and way above the orange and yellow lines, which is kind of the goal. We want to see us get way down below those. So we still have a ways to go, but at least we hope we're trending in the right direction. Some similar trends, not across the whole metro and area, but as you can see, outside of a few counties, almost the entire state is in high transmission. The county in blue is not reporting data. That's why it's blue. It's not because things are great there. They are not reporting their case data, so that's why we don't know exactly what's going on there. Clear Creek saw a fairly significant surge, but their numbers have been lower, which is good. But again, overall, almost everywhere above 200 except us and Clear Creek. So a long ways to go before we're kind of past all of this. Case trends through the age groups in the last 7 days. The highest age group is, again, one of the age groups that has been of concern is the 23 to 34-year-olds. They also have lower vaccination rates, so that's not a surprise and not a coincidence. But overall, the trend is a little more stable. We're not seeing any spiking. So again, a good sign that we're not seeing that rise. But again, we're seeing overall cases drop, so we would expect the trends here to drop too. Here's kind of what's going on. This is, I think, another piece of good news is, our disparity data is looking much better than it has over the course of the pandemic. So much, at least lower rates than what we have seen. So the rates for Hispanic, Latinx, down to 17% and 14% of our population. So that is encouraging to see that those numbers be much closer. So also good to see, again, you can see the trend of the overall cases dropping. Longmont still a little overrepresented, so that's something, again, a lot of focus for our staff in Longmont. And overall case counts, City of Boulder, 112 cases. They were at 172 the prior week. 215 cases in Longmont, and they were at 297 the prior week. So a slight drop from where they were the previous week in overall representation, but still much higher than what we would like to see. 122 cases in Lafayette, Louisville, and Superior. So actually a little rise there. They were at 118 the prior week. And then the other municipalities in unincorporated county were 117 cases, which is pretty consistent. They were at 116 last week. So still seeing an overrepresentation in Longmont. What's happening within our healthcare system? Unfortunately, this is still as bad or worse than the last time I think we checked in. We're seeing our systems really at or near capacity, depending on the hospital. The ICU beds may be at 100%. So hearing that from a lot of our peers. So our ICU bed availability dropped again, down to 3%. Same with the medical surge bed availability. Still seeing those staffing shortages, in fact, increasing. So again, everything kind of going in the wrong direction there. So really a need for folks to take precautions and really do what they can to not put a further burden on the system. For our county, 70 people are hospitalized with confirmed COVID, and then we have 14 ICU beds. That actually is a little better than what we saw. I think we were at 12 last week, so a little bit better there. But as far as the region goes, so again, we had 80. This is really tiny font, but just want to give you a perspective. People, often say, well, most of the people in the hospital probably don't have COVID. And I don't know what the percentages are, but there are a lot of people in the hospital with COVID in Colorado. So, it is well over 1,000 people hospitalized. This little pop-up bubble was some data that was shared from sort of some of the Denver hospitals, just to give you a perspective that an overwhelming majority of people are unvaccinated that are in the hospital. So why it's still so important to get vaccinated, that it does help prevent disease, but it certainly prevents the severity of disease if you do get it. So it's important that folks really still look at that and look at boosters if you're eligible. This is that similar graph of our case counts, but letting you know how far above our kind of epi capacity we are. So we're still way above what our ability to handle all the cases and do that investigation and tracing is. So we still really need to see this current surge drop dramatically. We're up to 61 deaths since May of this year. So you can see this fall and winter has been pretty significant, and we're not quite through it yet. And you can see where we were last year. So Delta has definitely been a significant player. And then obviously Omicron, we're concerned about what that might pan out to look like too. Overall testing, positivity has dropped and has been on a downward trend. So that is very encouraging. We are at about 4.8%. And that's really a big drop. So we were at about 6.6% last week. So pretty good drop there. So that's encouraging. And again, similar to the trend with overall case counts dropping. Vaccination, these numbers have not climbed significantly. They're staying fairly consistent, which means we're not really moving the needle a lot on folks that have not gotten vaccinated. And that's not totally surprising that those who've chosen are still really not doing it. We do hope that they pay attention to the Omicron variant, and maybe that's another incentive to drive up and increase those but we're just below 69% of our total population being fully vaccinated. We do expect it'll climb a little bit more, at least with the eligible populations, you know, now that we have down to 5 years old eligible, that we still have some momentum to make up there, but still need to get a lot more folks, especially some of those other younger age demographics. Just to give you a quick update on the Vaccine Verified Facility Program, we are up to 276 facilities. And just want folks to know, especially folks that may operate multiple facilities across the metro area, that Adams, Arapahoe, Denver, and Jeffco have all implemented programs. You know, they may not be identical as far as their application process, but they have very similar, if not identical, programs. I mentioned COVID-19 boosters. So each one of these is by age group. Obviously, the younger agers are either not eligible or not yet approved for those, but we have pretty high uptake on our kind of highest risk age demographics, and then obviously trending down as you get younger and younger. But it is really something that we want to encourage people to do, especially with the Omicron variant. So, and I'll show you some more data here in the next few slides. But one of the things we want to make sure people know, and I've shared some links that Corinne, I know she's probably shared in the past, but we'll continue to share on, you know, where do we find this? You can also call the COVID-19 vaccine hotline, and that can help you depending on where you are located in the state. But just locally, here's a list of some of the places that are providing. I added Costco. People have mentioned that Costco was doing walk-in appointments, and you do not need to be a Costco member to get them. So that's again, a walk-in without making appointments. Almost all the rest of these you would need to, you know, refer to their site, and we have links on our website to all these on how you would make appointments. I know availability has gotten better. So certainly a month or so ago, it was really difficult to find appointments, and that I think has improved, but you probably still may be a week or two out to get an appointment. So, but I encourage you to look at a lot of different locations, and you may need to be willing to drive a little bit instead of going to the closest place. But
and the other thing is that some of the 5 to 11 clinics that are going on, if you show up with your 5 to 11-year-old, you can get a booster, no appointment if your 5 to 11 is getting a shot. So yeah, that's some other options that are happening out there.
Yeah, and sometimes those clinics, if you show up near the end, they may have additional vaccine, and they would definitely want to use those up. So that's another possibility, but you're not going to be guaranteed a vaccine that way. But again, hopefully seeing a little bit better availability than we saw kind of a month ago. Just some state, and then I've got some national data of why should you get vaccinated. So again, it's been around, and maybe you've weathered the storms for almost 2 years and haven't gotten ill. That's fantastic, but you are more likely to get ill if you're unvaccinated. And then if you are exposed to COVID, the severity increases dramatically for those that are unvaccinated. So again, in Colorado, you're over 12 times more likely to be hospitalized and almost 11 times more likely to die from COVID. And those numbers all get worse as you look at the national picture. So for those that travel and are in areas, especially that have lower vaccination rates than Colorado does, the data shows that you're almost 6 times more likely to test positive for COVID when you're unvaccinated, and then your risk of dying is 14 times greater. So it's really important to get vaccinated. It does, you know, your likelihood of getting ill is less, but certainly the severity of illness, if you do end up getting ill, is your chances are much greater to do well with it than if you're unvaccinated. So we definitely have had, you know, media attention on what's going on with COVID. And we just want you to know, I keep sharing the data with you. Yes, things have gotten a little better, but they're not at all dramatically better. We are still way above where we need to be. And so our mask orders are still in effect. They are meant to be one of the strategies to reduce risk. we still need people to do it. We still need people to take these kind of precautions. We need people to get vaccinated. All the things we've been talking about for almost 2 years now are still important. Social distance, stay home when you're sick, get tested. All those things are still really relevant. The pandemic is still here. We are not out of it yet. So that's really important for folks to know, and that you're not getting hopefully mixed messages, which we know there's been information out there saying that. So this is small, but you will get a link to this. I think Corinne has shared this in the past as well. This is the chart Corinne has referenced many times in our past. So I just wanted to throw it up there so you know you're on the right page when you get there. But this really walks you through the protocols. Again, it's much more favorable for those that are vaccinated on what you need to do related to quarantine. Still same though, if you are sick, the same kind of isolation protocols, that when you're sick, you still need to stay away from other folks until you're meeting all the requirements of when you can go back. But this chart really walks everyone through what you need to do. So really want to make sure folks get access to this, and I've shared the link again, so Corinne will put that into the information. And I know she sends a lot of information, so it is really important that you sort through that email, because there's a ton in that. And
I put this at the very top of the last email because this is the #1 question I get. I have someone who's vaccinated, tested positive. What do they do? Well, they tested positive for COVID. It's the top line here. They still need to isolate for 10 days plus 24 hours post if they're symptomatic after the 10 days. So that's that first line. Then if they have symptoms and they were exposed, here's what they do. If they're asymptomatic, here's what they do. So I put at the very top of the email this last time because I have a copy of it right here in front of me because it's the #1 question that I get these days.
Yeah, when you're sick with COVID, it's the same kind of protocols. Your chances of becoming seriously ill when you get COVID, when you're vaccinated, are much less, but you still have it and you can still spread it. So that's why it's the same protocol on isolation, regardless of if you're vaccinated. But if you've just been around someone who is sick and you are vaccinated, your likelihood of getting sick is much less. So you're really just doing symptom watching rather than a full quarantine. But anyway, that chart will walk you through everything. And I think our staff did a really nice job of putting that together. So if you still have questions after looking at that, you can feel free to reach out through our COVID line to get more information. Omicron, this really looks like Africa when I was looking at it. And we know that South Africa has kind of been a source of where a lot of that spread has been moving. But you can see this looks dramatically different than that picture on the very opening slide. And that's because of the mutations. So again, this is super technical, but the 30 spike protein mutations that this Omicron variant has. So again, it looks radically different, and it is likely going to operate differently. And so that's what we are very concerned about. How will it behave? And I'll share at least what we know so far. So here's some information coming out of South Africa. This is not the best reference because overall vaccination rates are not as comparable to what we have here, but this is what's happened there. So again, you can see the different waves of the different variants as they hit in South Africa. And obviously the Delta variant was significant impact in South Africa as it has been here. But this Omicron, this is again spike in cases on a 7-day average is almost immediately spiking. So that's consistent with other countries too. That means this variant is very transmissible. So it is spreading very rapidly and making a lot of people sick. So that is obviously very concerning. We don't want to see variants that do that. Here's a more recent one. So again, when it was first detected in South Africa, and then within 30 days, it's just on an immediate spike, whereas the other variants had a little bit more of a lag to get to that significant spike. And then we'll continue to watch. Again, this is still so new. Information is changing all the time, so we'll continue to watch that. This is some information coming out of England. So it has hit in Europe that really the initial cases all had travel. So that's why you see this black travel line that just immediately spikes all those people with travel. But you can see how quickly the locally acquired cases are surging. So they're rapidly seeing increases. So again, concerning that this, based on that data, also is saying it spreads very rapidly. And then expanding that to some of the other countries, Denmark and Norway, who've had some significant issues, a much higher likelihood of household and close contacts getting it. So again, showing that it is highly transmissible. And then they are expecting this to outcompete and become the dominant variant in mid-December, which is basically right now. So, and that will likely be something we expect to see here. But again, they're very concerned that it's just huge increases in cases. The other side of it, which is how severe is it? So if you get sick, how sick will you become? Still not a lot of data, but we hope that it may not be as severe. So a lot of people getting sick, but hopefully not as many hospitalizations as what Delta is causing. But it's still concerning that even if it's not as severe, if more people are getting sick, that still will eventually get some people to severe illness and cause hospitalization. So it may even in the end cause more hospitalizations just because of the volume of people getting sick. But we really don't know. So a lot of questions still on that, but it is likely to further strain our hospital system. So it's very important that we continue to take all these same precautions. And the data so far looks like the booster dose is very important with this variant, that the immune system, it naturally will wane, but with this variant, those that got boosted saw basically the similar resistance as to when they were originally vaccinated against this variant. And in those that have not been boosted and it's been 6 months or more, saw much lower resistance. So another plug for folks to stay there. Honestly, you should just kind of think of this as like the flu shot. You get it every year just to get yourself boosted for what's going on and what's going around. And that's ultimately where we'd like to be with COVID, just thinking of it more of an endemic disease that unfortunately we have to deal with. And these are the strategies we use. So I think those boosters are going to be important for folks. And then just to close out, some additional resources that we share and that share with Corinne as well. And now happy to take questions.
Thanks, Lane. We only have 2 questions in right now, but I have a couple others for you as well. Oh, no, they're starting to come in. So we'll start with the mask criteria. I think if you could just clarify when you lift the mask criteria, I think it's clarifying the current order and what the metrics are that allow masks to be removed, and the numbers for that, the number of days that we have to be at that number. And then we can move on to the other questions. So currently we're at 185 cases per 100,000. So if you could just clarify what the order says, because it's not really lifted, it's just the order specifies a level in which we have to hit.
Yes, we want to be below 50. So again, we are still 3+ times that level, and we need to be in that 50 or below 50 for 21 days. So we need to see that number drop and then really be stable at that low level. As you know, our spike, we've seen things bump up and down. So we have quite a ways to go to get below there, but that would be the trigger where we would relax the mask order. If we saw it start to surge again, kind of within sort of that shorter time frame, we potentially would put masks back in place. But that's why we really want to see it stabilize, so people we aren't bouncing back and forth, masks today, no masks tomorrow. But we've got a ways to go. We need to be below 50.
So we have to be below 50 cases per 100,000 for 21 days for the mask to be taken off. That's the current criteria under the mask. It's not based on hospitalizations, but hospitalizations usually follow the case counts. So you know that the case counts are pretty indicative of the hospitalizations. Will the guidelines for the mask removal be reconsidered at all, or is this going to be the mask order for a while?
Yeah, I think we certainly we continue to watch all of that data. So that was the easiest metric for people to see. That's a number that is easily quantified and that we're readily sharing and updating multiple times a week. So that one's the easiest to notice. If we see our hospital system really get out of this crisis, that would be something we would look at. But with Omicron, again, I don't expect we would remove this, because it's going to be even more important that we prevent spread of that, because I think that we could see even a bigger surge on our hospital system. We also know that it's flu season and this helps prevent flu. And so we are concerned about all the different strains that are sending people to the hospital. So we always are looking at this to see what strategies are needed. And honestly, this is the sort of the easiest strategy for people to do. I know people don't like it, but versus closing businesses down, limiting the occupancy, those are strategies that work too, but they have significant impacts to those businesses. So the more people can help prevent this spread, the less need to take further action is. So we really need folks to help prevent disease.
And I'm glad you're on this screen, because the next question has Boulder County ever been at 50, below 50 during the entire pandemic? And the answer is yes at the beginning. Anytime you're below that substantial transmission line. So it's,
yeah,
anytime you're below that orange is below the 50. So
it was kind of May of this year, we dropped, and we dropped really significantly. And then unfortunately in July, things started back up and really haven't recovered yet. So again, you can see that graph. So it's been a long time since we've been close to dropping below that. It's been 5 months.
Okay. And in that May, kind of everything went away. So we kind of went to level clear, and we dropped the mask. So it was kind of we went back to normal in a lot of ways at that point in time too. So someone asked, so we talked about the criteria. It's tied to the number of cases per 100,000. Somebody asked, referenced Governor Polis, and saying that that the local health departments probably want people in masks for a long-term period. Can you just make reference a little bit to Governor Polis's comments? And we know that some businesses have been presented a copy of Governor Polis's comments over the past week, and maybe just clarify some of those comments if you can, or some of the retractions that have come out, or what might have been said, if you can.
Yeah, I think it's just overall unfortunate. It didn't retract any of our need for orders, or actually retract the orders. The orders are, like I mentioned earlier, are needed and are still in place. So those NPR statements don't mean people don't need to wear masks. They really do. And you really should wear them anywhere, not just in Boulder County. Most of our neighboring counties have orders already. So it's important as you're traveling, as you're out and about, it's still very needed. Again, it was unfortunate that those comments were made. But I would really encourage folks to follow the Center for Disease Control, follow the public health professionals, the people who have spent their careers understanding diseases and how we mitigate them. And that's where you should get your information.
So you noticed in my email, it said still in effect, underlying, because I was getting I know you guys got a lot of questions and calls as to did the mask order go away? And the answer was no, because while people may have misconstrued some of his comments, they also didn't bring in his retraction, which was, no, the state health department doesn't have mask orders. We're concentrating on vaccination efforts. And the local health departments are concentrating on mask orders, which was what he came back and talked a little bit more about. So somebody has put in a question referencing the Gold's Gym article in the Daily Camera and saying that some businesses are being super brazen about saying they're not abiding by mask mandate, like the Gold's Gym in Longmont that was featured in the Daily Camera article. Are you guys doing anything about them? Can you share, and please can share that, please, so that they don't empower others to violate the mandate?
Yeah, there's a court order for compliance there, so there is enforcement action that's been taken. Can't get into a ton of details, but we're hoping that changes. But yeah, there's definitely been action taken related to that facility.
And the Daily Camera article did talk about the judge's ruling that they have to abide by the mandate in that way. Okay. What can vaccinated people do to avoid hospitalization, especially if they test positive? Is this a little bit about vaccinated and unvaccinated? Can you talk maybe a little bit about the monoclonal antibody treatment?
Yeah, that's a treatment that you would work with your provider to get. It's something that needs to be done early on in the disease, so kind of in that first 5 days, week of becoming ill. And that's a treatment, whether you're vaccinated or unvaccinated, that people can seek. And that has a very high rate of diminishing severity. So very, very good at diminishing those that may end up hospitalized. So that is one thing. I think the rest of it is, back to the prevention side. So being vaccinated, don't believe that you cannot get ill. You can, so you still should take the same precautions of wearing your mask, social distancing, trying to do as much outdoor activity rather than indoor activity. Don't be careless because you're vaccinated. So, but once you are ill, that's currently the main treatment that is available that has pretty high efficacy for reducing severity. There are some more antiviral agents and things that are under investigation and that their emergency use approvals have been requested. So we're hopeful that we start to see more medication that's available for folks. And there's some very promising medicines out there, but we're still, a ways out from seeing those very approved and then available. So prevention is still always our number one means, but monoclonal antibodies is something, if you find out you're ill, especially if you're in a high risk category, that would be something to inquire about and really potentially seek to add that treatment.
And I put the link to the information in the chat. This is something that if you need to go to the ER, go to the ER. I mean, if you watch the press release or the press conference from the governor about this, it's not for somebody who's very sick to just go to a monoclonal, bus, go to the ER. But if you're early on, your symptoms start in the last 10 days, you're not hospitalized, you don't need oxygen, you can seek this treatment. So I put the link in the chat, and I will send it on in the email. I think I've forgotten to actually send this information on. And it talks a little bit about who's eligible for this treatment and where the buses are that the state is providing, because you don't actually have to get a prescription for this treatment at this time through the state. So that is one thing that we haven't actually talked about on these webinars up to this point. Can you go back to slide 3, please?
I'm also just going to mention that you don't have to wait for the buses either. So you can still get that through healthcare providers, because the buses are not a constant. Slide 3.
But what's our current number? I believe. I think we were on it.
Yeah.
So we're at 181.6.
Yeah, and all my data, our data folks are amazing. They pull all this data for us on a weekly basis and give it to us on Tuesdays. So the data is usually Monday's data. If you go to our websites, it'll have our most current data. So things are changing on a daily basis, but this is that snapshot as of 9 a.m. on the 13th.
All right, so I know you work with a lot of restaurants. Are restaurants experiencing patron confusion regarding the mandate stating when masks may be removed? Is it while seated at a table or while in the act of eating and drinking versus seated and eating and drinking? The
Yeah,
or versus and is a big difference. So what's the rule?
it's when you're eating and drinking. So seated and eating and drinking. If you're just seated, you should really still have your mask on. We know that that's probably ranging that some people, as soon as they get to the table, the masks come off. You need to know that those those are still risky situations, especially without social distancing. So those have not been things that have been put into place, but they're still very important. And it's great if restaurants are proactively doing that. I was at one this last week, and they still were spacing all their tables out, and I applaud folks that are doing that kind of stuff, because that is a very proven strategy, and it will help us prevent disease. We also know that restaurant workers are at much higher risk of getting COVID, and it's not surprising why, because they are around a lot of people who are unmasked and potentially unvaccinated. So it's still really important that we take those precautions, but it's meant to be when you are eating and drinking. So it's not anytime you're in the restaurant and you're not walking around.
And the order actually says while in the act of eating and drinking, because of things like networking events and things like that, because people might be standing and eating and drinking. So when you're at a networking event and you're standing, you're still going to need to wear your mask, except for when you're in the act of eating or drinking.
I think it was expanded, so it's eating and drinking specifically, because there are, I think, concert venues where they don't actually have anybody seated, but they are still, providing either food or drink. And so there was sort of an inclusion of those situations too, but it is focused on when you need to take your mask down so that you're eating and drinking. Otherwise, you not because you have a beer that now you never wear a mask the whole night. So,
and I had a restaurant owner on a panel this morning who talked about even when he reopened, he didn't reopen at full capacity. He still used his outside space because he knew the comfort levels weren't, I'm going to go back to 2 feet. I'm going to stay still pretty little bit farther distance. Also, staffing concerns made it so he couldn't staff at full capacity either. All right,
yeah,
question about businesses receiving PPE, masks, gloves, and so forth in 2022, whether there will be any programs for that. I'm going to answer on the City of Boulder side, but I'll let you answer that question, and then I'll talk a little about a mask program I have going.
yeah, I don't have any, I don't know of anything right now. That would be something, if there's a significant need, we can put those into all the different request needs to see how we potentially could allocate funds for that. But as of right now, I don't know of any plan to purchase PPE for facilities.
Yeah, early in the mask order, I was able to procure a small number of masks for just for as needed leftover masks from the CARES Funding Act. And then City of Boulder, if you're a City of Boulder business, small business 25 and under, you can put in a request from me, and I can get you masks. City of Boulder did work with us on procuring 140,000 masks to give out to businesses. We've been doing it for over a month now, since homecoming weekend, and we've distributed over 75,000 masks to downtown, 29th Street, the Hill, and I think I have about 85,000 left. So I just got another shipment yesterday. So that was something we worked with the municipality on to try to do, because we know that you're going through masks like water at some points, especially if you have visitors from out of town that aren't used to using masks. So it's something that I know that the local partners are keeping on the radar of, but I don't know of any other organized programs out there. So if you are a City of Boulder business, please contact me. I can get you some masks. If you're outside the City of Boulder, I only have a few masks left of the original procurement that I had. So
I think it is important that communication to patrons is please bring your mask, because this is a burden on the businesses to
Mhm.
constantly provide them for people. And we know almost all people have masks. So it's really,
Yeah, we were finding that in areas where people are coming in from out of town where they don't have mask orders, it's to the conflict was reduced by just saying, hey, here's a mask,
yeah,
like,
no,
and they didn't have masks with
I
them
agree.
because they were coming to town from out of state for game days, for example, and just showing up because their states didn't have mask orders or their counties did. I think it's a lot easier now that the whole metro area has mask orders. That's making it a little bit easier on the travel between counties and workers coming from different counties. So thank you for that. I know who that question came from. So thank you for that question. If we continue to see further need, maybe we put together a request. But any other questions out there? I know there's been a lot of questions about isolation and quarantine. I really do point as many people to that chart as possible, because that is the number one resource there is on what do you do? How do I map that out? Who would I call? What do I do? We did have a question that came in about false positive tests. Oh, yeah, I have another question that came in. False positive tests that you're still trying to get answers on, Lane. But so the person who did ask that question, just know that we're waiting to get some further clarification on false positive tests. Do you have anything you want to add on that before we, and we'll email the person back about any of the false positive data.
Yeah, I think it would just be helpful to get more specific of what do they mean. Again, that they believe the test was inaccurate, or that they had a positive and then they got another test that was a negative. Are they worried about, are we reporting information that may, the initial test was positive and then the next one was negative? So just to get more clarity of what they're wanting to know would be helpful too. But I have reached out to some of our other folks to get their sense on how to help answer that.
If someone's not following the mask mandate, and if a business not following a mask mandate, is there something that we as individuals can or should do? It may be hard for some to say something to managers directly at that said business, but is there some place they can call?
Yeah, our COVID biz team, you can call the call center and they sort through complaints and get that to our team. So yeah, if there's a concern for non-compliance, that's what our team
So it's the call center line that I put at the end of the emails. I'll put it in the chat here in a minute as soon as I get through the questions. The next question is about the vaccine verification program. So it's a numbers game. It's a I talk about this program a lot. It's a denominators game. You need to have 95% verified vaccinated. So you need to have a minute, in a lot of cases, you're looking at, if I have 20 people on site, I can have one unvaccinated to have that. How do you, people are this person's asking what's an effective way to manage this, and how do I guarantee that I have such small numbers? How do I guarantee that I'm going to have the 95% on any given day on those 2 days? What's your advice for that company? Or do you suggest they apply and work with the vaccine verification program team to find the best policy that works with them, to apply and just to work with the team to figure this out?
Yeah, that is what we recommend. That if you think you can at least get close, or that you have systems that are in place and there might be some variability day to day, but overall you're meeting that, definitely apply. There's, depending on the type of business, there's different strategies that might work better on how would you verify. If it's your office and staff, that's pretty easy. You can kind of verify status of all the employees, and then you know where you're at. It also is an opportunity for those that may not be to look at, again, can they work remotely? Are there other assignments? And maybe there's even one day a week where you're not able to do it and you go back to masks. So there's a lot of flexibility built into the program. But yes, we would encourage you to share your situation so we can work with you to try to see if it is possible to get there.
And the one thing I worked with a company yesterday, and we said, you know, these rooms would be your vaccine only rooms, and then the other rooms are wearing masks. Or you do 3 days a week that are vaccine only days, and maybe the other 2 days are the days that your unvaccinated show up for their 2 days of work. Or, you know, you have such a large denominator that one person's not going to affect as much, and you're not going to have to worry about it. Or anytime you bring in customers, everyone wears masks so that you're not having to verify from your customers. There's a lot of flexibility in the program, and your goal as Boulder County is not to reject an application. It's to work with a business and to try to find the best way for this application to go through, and find a way for you to make it work. And I've worked a lot with a lot of the businesses that have put through applications and found ways to make this work. So my suggestion to the person who put in this question is to submit something. They'll work with you, figure it out. And somebody said, just note of gratitude, we found that having approval from the vaccine verification program has made it easier for us to talk to potential and new employees about their verification status. I also talked to one of the early recipients of the program the other day, and they said it's been a game changer, that they were very nervous about doing it, because they are open to the public. And, you know, they lost some people, but they gained more people than they lost. And they also feel like they're helping propel more people to become vaccinated, because those people want to use their facility. So, you know, I think that people are weighing their options. They became very flexible on how they did it and so forth. So please, if you have any questions, please reach out to the team for vaccine verification program. Or, I mean, I've answered a lot of questions as well. I can point you into the right direction. How do you tell people that have had COVID that they still need to get the booster?
I mean, that's kind of part of what we shared today is, you know, there's a lot of reasons why that's important. I would say Omicron is one of the biggest drivers, that we have a new variant that is likely going to take over in Colorado. So certainly likely in the next month or maybe so, we would expect to see a whole lot of those cases, and you're going to be much more protected if you're boosted than if you don't. So we know we started seeing those breakthroughs of the Delta variant, and we're likely going to see that with Omicron as well. And again, hopefully it doesn't have the severity that Delta does, but either way, keeping your immunity high is the strategy. It's why we've done flu shots on an annual basis. That's boosting your immunity and trying to dial it into what they think is the predominant flu strain that's going to hit that year. So similarly, I would expect there'll be these kind of strategies. Luckily, so far, the vaccines appear to continue to work on the variants, but as we know, Delta has challenged that more than the other strains did. And so hopefully, again, we'll see with boosters that we're able to weather Omicron a lot better.
All right, so now we're talking a lot about boosters, but without the vaccine verification program, with, you know, the OSHA requirement, with vaccine passports, fully vaccinated still means two shots of Pfizer and Moderna, 2 weeks past your 2 shots of Pfizer, Moderna, or 2 weeks past your 1 shot of J&J, correct?
Correct. We will be looking at that though, especially based on Omicron, knowing if that's going to really take over, you know, it won't be the same assurance that we had under Delta. So that could be something that we reflect on for the program is the need to add boosters into your program.
This time, that is not a requirement.
No, it's not.
Okay. If you are vaccinated 6 months plus and have had COVID, is it correct that you have to wait 3 months after having COVID to get the booster? Is that something you can answer, or do they need to talk to their physician?
Yeah, I would look at that. I know there is a period of time that you want to wait, but I don't know specifically what that is. And I would encourage you to talk to your provider about your specific health conditions and risks, because there are people who are unable to get vaccinated, and depending on what's going on with their medical situations.
All right, any more questions out there? Every time I say that, 3 pop up. So I always do the last call. I feel like a bartender. While I'm doing that, I'm going to tell everybody, please stay safe with the wind. Keep your dog safe too. I was telling Lane beforehand, my biggest worry yesterday when I watched my grill go flying over my fence into the mailbox was that I didn't want to put my dog outside, my 21-pound dog. I could just envision it flying away. So he's out on a leash the whole day. Some of you have met my dog on these webinars. All right, that's enough stalling. No more questions have come in. Thank you for joining us for the last session of the year. We are going to start up again next year. We will probably have a shakeup of who's doing these sessions, Lane occasionally, Tessa, but continued support from Boulder County Public Health. We're going to do a special session. I got this booked yesterday on January 20th at 1 o'clock. It's during that normal Thursday hour with a special counselor. He does a lot of EAP programs. He's very qualified to do this, but he's going to do it on dealing with consumers, those tough confrontations with consumers and how it affects your staff and some of the ways that you may not know it's affecting your staff. So dealing with consumers, tough confrontations with consumers, and we're talking gyms, rec centers, retailers, restaurants, hotels, museums, and then ways to help your staff, especially if they have past histories. So that's on January 20th at 1 o'clock. This was recommended from Boulder County Public Health, who had gone through it. I worked with him yesterday. It will be a special session, but we'll probably do an update on the 13th prior. So I'll put all of that out of registration pages, but that is please mark your calendar, especially if you're dealing with consumers and continue to deal with anybody coming into your doors. So we'll continue to provide some of these special as needed sessions and support and resources that you need. Remember that the resources I sent out on yesterday's email include those frequently asked questions, those falsities around vaccinations directed towards businesses that you can put up that answer some of those questions that your employees might be asking that you can't answer, as you requested on that one vaccination webinar. So those are provided. I will continue to provide those. Anything else, just feel free to reach out. I am taking a little bit of time off. Lane's taking a little bit of time off over the holidays. So everybody have a safe holiday. Don't blow away today, and we'll see you in the new year.
Thank you all. Happy holidays. Stay safe.